Health leaders on both sides of the state line say supply is the main issue slowing down the rollout. But do states have a supply of doses that are going unused? 41 Action News reporter Kat Reed is going in depth to get answers.
The big question we wanted to answer is how many distributed doses have actually ended up in arms in Missouri and Kansas. It gives you kind of an idea of how efficient the rollout has been. So we are using data from each state's individual dashboard. Let's start with Missouri, where 61% of distributed doses have been administered. The figure includes the doses given directly to state partners and vaccinators, plus those distributed to pharmacies through a federal program for long-term care facilities. Now, you may be asking yourself, why isn't that percentage higher? Well, Governor Mike Parson says it has to do with the federal program for nursing homes, which is included in our state data. Dose estimates for that program were based on 100% capacity and one-to-one staff ratios at facilities. So not all of the doses were used. And that's why Governor Mike Parson is asking CVS and Walgreens to send back their unused doses so they can be redistributed in the state. Now, a spokesperson for the state health department added, quote, "There will always be some lag present. Shipping 1,000 doses of vaccine logistically looks different than getting 1,000 doses into arms." There is hope that this will speed up as the Biden administration is giving states more advance notice of how much vaccine they'll receive. Now, let's move on to Kansas, where 60.4% of distributed doses have been administered. A spokesperson for the governor said a reporting gap is to blame for the lower percentage, saying KDHE has opened several lines of communication with local health departments and healthcare providers to reduce the reporting gap without reducing the capacity to vaccinate Kansans. Now, with any numbers, it's important to put them in context. So if you look at the other CDC percentages for vaccines administered, Kansas and Missouri are about in the middle of the pack. But there are states that are doing better, like West Virginia, which has more than 80% of its distributed doses administered. I'm my team reporter Kat Reed, 41 Action News.